Hi, hello friends. How are you? I hope everyone is doing good. So, what are your plans for Sunday? क्या कर रहा है आज? So today's topic, we'll select a topic on branch selection जैसा. So some of one of the subscriber asked me, sir, can I join DNB Orthopedics in Joy Hospital, Somaziguda, which is located in Hyderabad. Good evening, Sai Chandra garu, relaxing and reading book. You are great, sir. Nice. I thought of sleeping in the afternoon. I finished my OPD in around 2:30. मैंने सोचा कि okay, I'll sleep around. I had around my lunch around 3 o'clock. I thought I'll sleep. Then I later realized if I sleep now, I find it sleeping difficult in the night. So I thought uh, I'll make few videos, share whatever knowledge I have, and I thought I'll make a. I tried Insta live, but my voice is not audible there. So I thought I'll do a YouTube live. Uday Patil, hi, good evening. So in today's topic, we'll select regarding how to select uh, which branch to select. But in all my videos, what I observed, uh, videos where I talk about orthopedics, where I talk about surgeries are getting less views, and the videos where I talk like which branches to join. Um, Altaf garu, good evening, Andy. Good evening, sir. So, which branch to join, which branches are getting more, ఏ బ్రాంచెస్లో డబ్బులు ఎక్కువ వస్తాయి, ఇట్లాంటి వాటికి వ్యూస్ ఎక్కువ వస్తున్నాయి. సో అది. And just now one patient messaged me, sir, are you available now? I asked whether it's an any emergency. They said nothing, sir. We want to consult you, bolke. Then I told I have seen OPD till 2:30. So if it's not emergency, please come tomorrow, bolke. why why many of the students, they are more connected with the money, where which branches are getting money, which branches are earning more, those videos are getting more views. Emotional content more views. Thank you, sir. Thank you. Jeel Shihora. Hello, good evening, sir. Hi, good evening. So we'll discuss about the branches, which branch to join. So in which branch you are interested, you please join in that branch. Whether you are making money or not, that is secondary, because you cannot satisfy with a branch where you don't have the interest. See, I am really interested in orthopedics and general medicine. So I cannot imagine myself joining either ENT, opthal, radiology. So my main interest is either in orthopedics or general medicine. So I joined in ortho because I could not get general medicine in those institutes what I thought. But ortho I got in Tejashwini, which is very good hospital. So I joined there. So many of the students will be asking, sir, can I join this branch, that branch? So, sir, can you tell solution for stiffness after ligamentous injuries? Uday Patil ji, I asked you to send your X-rays reports to my WhatsApp number. I think you have not yet sent. So basically, this is a very big topic. We cannot. Uh, అంటే see, we need to see what is the reason for stiffness. What is the fault? So if surgery everything is done perfectly, sometimes if the patient doesn't do physio properly, then there can be problem with the knee movements. So we need to see what is the reason for stiffness. Is there any ligamentous injury? If there is ligamentous injury, what was the ligament that was involved, like ACL, PCL, MCL, PLC? So ligament injury को क्या किया, कुछ सर्जरी किया, कि सर्जरी किया बोले तो कौन सा सर्जरी किया, कौन सा इम्प्लांट डाला, ओके सर्जरी किया कैसे किया, वो इम्प्लांट किधर है, अच्छा से फिक्स हुआ नहीं हुआ बोल के ये पूरा देखना पड़ता. सो उसके वजह से आपको मैं बोला आपका MRI रिपोर्ट्स एंड एक्सरेस को मेरे व्हाट्सअप नंबर को भेजने के लिए बोला. सर शुड वन टेक DR दो CPS if it's only recognized in your state, and what should we look in hospital to decide? Brother, my sincere advice is don't join in DR दो CPS. My sincere advice. I'm feeling you like as my brother. I'm telling you, if you are getting MS, join in it. If you are getting DNB, join in it. Because doing DR though, again struggling for 2 years, it's a lot of struggle, brother. Do you want to struggle? Or yes, see, struggling is needed. Why you want to again do DR though, again DNB? Rather than that, do directly DNB. That's better, no? And to be very frank, I really don't know about DR though CPS. And I think it is uh, given in Maharashtra, I guess. And yesterday one patient asked me, sir, do you do ACL internal bracing बोल के. So I asked him, so why do you want internal brace? So see, internal bracing for ACL reconstruction is not for every patient. It's for those patients who really require. Okay sir, I also decided to not join, but multiple attempts, so everyone saying you should join. Bro, कौन सा attempt you are in? Which attempt you tell me? See, if it's your second attempt or third attempt, like okay, but I'm preparing again, hoping MSDNB. Yeah, bro, fourth attempt. Okay, but still you join DNB where you get some other branch, because see, I think now you will be already 30. That's what I guess. You have to marry, kids. These things will be getting delayed. So if subject is not a matter, 29, yeah. See, that's what, if subject is not a matter, I mean branch is not a compulsion or matter, you join in other branch like pediatrics. Anesthesia is really good. Really, I am telling you, anesthesia is far better. So I have a few friends who are earning around 2 to 2.5 lakhs. They have done their DNB anesthesia, then their critical care fellowships. They are working in corporate hospitals. They are earning decently good. See, in anesthesia, you can think like you will get fixed income, but pediatrics and other branches, now you cannot think that you will definitely get fixed income. It's not possible like that. Akhilesh Mahender, good evening, sir. Good evening, brother. How are you? See, especially after COVID, no, even the senior practitioners for the pediatrics, the patients were less. Yesterday, one of my friend, he's a pediatrician. Vishnu Vardhan, good evening, sir. Good evening, brother. So yesterday, one of my friend, he is a pediatrician. He was telling, Sai, some pediatricians they could not even pay the rent, especially in areas in metro cities where the rents are 1 lakh, 2 lakhs. So paying rents is also not that easy. So don't underestimate anesthesia. It's really good branch because India is such a huge country, and you won't believe in many cities, sorry, in many towns there are still no anesthetists. And people from bigger places, bigger towns, they go to that rural areas and they help the gynecologists in deliveries, cesarean sections. They give the anesthesia and come back to the native place because there are many towns where there are still no anesthetists. Option of joining CPS DA or DR though, or to prepare for 2023 exam with joining hospital for few months in starting. Option of joining CPS DA. My personal preference is if you get DNB or though you join, brother. Otherwise you prepare for again one more year because I really don't know about CPS DA and DR though, and somehow I am not happy with that. I don't know why MCI or NMC still they are continuing the DR though. It's my very personal opinion. See, they can make a uniform degree like so. MS is there. DNB they can make again DR though 2 years. Why? What is this? 2 years DR though. Again they have to write the entrance exam. Again they have to do the residency. Again theory. Again practical. By that time they will be already 30, 31, 32. Sometimes maybe even 35. So, sir, మీరు నీట్ యూజీ రాశారా? నో బ్రదర్, ఐఎమ్ 2007 బ్యాచ్. దట్ టైమ్ దెర్ వాజ్ నో నీట్ యూజీ. ఐఎమ్ ఫైన్ సార్, హోప్ యు ఆర్ డూయింగ్ గుడ్ టు యా took anesthesia after watching your short video of orthopedics and anesthesia. Yes, brother, you'll definitely not regret. I'm telling you, don't stop with anesthesia. Try to do critical care fellowship, or if possible, do FNB critical care. You'll be easily getting 2 to 2.5 lakh salary. And if you are married to a doctor, even she will be earning around 1 to 2 lakhs. So if you are settling in metros, 4 lakhs you can aramse you can make per month. See, once you have own home, own house or apartment, once you have got kids, so 4 lakhs per month is decent enough. So anything more than 4 lakhs is, I think, is extra money. That's what I feel. You will see, to go in a Range Rover car or a Audi car, definitely a surgeon who has hard-earned money, we people know we don't find real happiness in driving a Range Rover. Frankly speaking, we find more happiness in treating patients. So with 4 lakhs per month, we can definitely buy a Honda City or a Creta car. No DNB allowed after it. Acha, okay. I don't know about that, brother. I really don't know about that. So it's up to you. It's your personal opinion, personal choice. Discuss with your close friends, best friends. Discuss with your well-wishers and parents. Then you can plan. In Hyderabad, it's heavily raining. Even now it is raining. Even yesterday we had rains. Even now it is raining. Thank you, dear. So which hospital? Where are you working? Where did you join? So you are from which place? And in the last 3-4 years, I got many mails, many messages in Facebook. Sir, which hospital to join? Which are the best branches to join? And my preference is always used to be developing practice. See, YouTube videos and all are secondary. See, first we should have solid practice. Then only we'll get that happiness, satisfaction of doing the పీజీ ఇంత కష్టపడి చదివినందుకు, ఇఫ్ యూ డోంట్ హ్యావ్, ఐ మీన్ దట్స్ మై పర్సనల్ ఒపీనియన్. సో ఐ డిడ్ నాట్ రిప్లై ఫర్ సో మెనీ స్టూడెంట్స్. I think that is one strong reason why my channel has still not crossed the 10,000 subscribers. I am from Hyderabad, sir. Joined NIMS. Acha, very good. 2-3 days back, I referred a patient to NIMS. He has some, I think, rheumatoid arthritis, multiple joint pains. Nice. I'll have your number, brother. Hi, sir. I have osteomyelitis by last 2.5 years. And pain is increasing day by day. Now taking linezolid 300 600 mg. What's your opinion on this problem, sir? Sir, you told you are having osteomyelitis. So which bone, sir? Do you have the reports? You have any reports? Please WhatsApp me to my WhatsApp number 9573 517 107. Akhilesh, we'll meet once. Okay. If possible, I'll come to NIMS once. We'll meet here. Subham Kumar ji, please send your reports to my WhatsApp number. एक बार आपका रिपोर्ट्स मेरे को व्हाट्सअप कीजिए, मैं देख के बता दूंगा क्या करना, कैसे आगे चलना बोल के. We'll know the, see, whenever we see a chronic osteomyelitis patient, we need to see what is the extent of chronic osteomyelitis. There is a classification for that, CRD MEDAR classification बोल के. So whether it's cortical, superficial, medullary, diffuse, and that is anatomical. Host, how is the host? Like whether you have got any comorbid conditions like diabetes, hypertension, tuberculosis, so these things. So over the phone it is little difficult, but please send your old reports to my WhatsApp number, and the leg photo. If you are suffering the tibia, send the leg photo and all the reports, even the blood reports. Then we can plan what to do. Cuneiform and metatarsal bones, sir. Acha, it's very rare. I think we need to rule out even the fungal osteomyelitis. एक बार आपका reports भेजिए, sir. Can you message your WhatsApp number in the chat? Okay, I'll do that. No, I cannot do that because last time even I tried. I'm not able to do that. So I'll tell you, please save that 9573 517 107. One minute, friends. హరీష్, ఆయన హరీష్ అన్న ఎక్కడున్నావు, ఏం చేస్తున్నావు? షుడ్ ఐ గో ఫర్ ఆపరేషన్ ఆర్ గో ఫర్ होम्योपैथिक मेडिसिन? सर दैट्स व्हाट आई एम सजेस्टिंग यू सर. प्लीज़ आपका रिपोर्ट्स है ना, उसको एक बार व्हाट्सएप में भेजिए. मैं I have very good seniors, so if it is beyond my knowledge, beyond my expertise, मैं उसके सीनियर्स का ओपिनियन लेके आपको बता दूंगा. देन विल डिस्कस. So I'm really feeling happy. So nowadays my videos are getting more views. I'm happy for that. Sir, please tell once again WhatsApp number 9573 517 107. Some people they are commenting like this guy has become busy nowadays and he is not replying. Brother, to all my friends, say I came from proper middle class background, and my father he paid my MBBS fees 55,000 private A category. After that he did not pay me any fee. I cannot boast myself telling I am that man, this man, like that, but I don't have any back support. Whatever practice I have got now, it's purely with my God's grace and hard work, you can tell. So I have to manage my OP, I have to manage my surgeries, I have to manage my hospital, I and I have to manage my small diagnostic center. So I have to, it's a one man army, like you can think. So please understand. Which branch, which branches to prefer ortho than radio and derma to have work life balance and decent money? Sindhuja, which branches to prefer ortho than radio and derma to have work life balance? I did not understand your question, but okay, I'll tell you, madam. Uh, if you are interested in radiology, please join radiology, madam, because it's much better than orthopedics on any day. Because orthopedics, kya hua, it's a surgical branch. So I can do ACL arthroscopic reconstruction. See, daily, so monthly at least I get around 10 to 15 surgically indicated patients, those who perfectly require surgery. But I'm doing roughly around 2 to 3 per month. The reason is they all go to senior surgeons. By seeing the my face, they'll think he's very junior, maybe he don't know or something like that, or he's not having experience in that. So because it is a surgical branch, orthopedics, they tend to go to seniors. Even if we are having some problem, if we need surgery, so we definitely go to a senior doctor, isn't it? So in the same way, so in the same way, uh, so what I am talking, just now we switch on the lights. So in the same way, even the patients think the same. So if you have got equal interest in orthopedics and radiology, radiology is much better because an average radiologist, he earns much better than an orthopedic surgeon, at least initially, because all the bigger corporate diagnostic centers, they pay you roughly around 1.7 to 2 lakhs once you finish your MD radiology or DNB radiology. If you join medical college, you will be paid roughly around 1 lakh as an assistant professor. But for orthopedics, if you finish your MS ortho or DNB ortho from a good hospital, you will be paid roughly around 60 to 70,000 as an assistant professor, or 75, max 80. Very few hospitals or medical colleges, they pay you 1. So corporate hospitals, they'll definitely take you like a registrar, where they'll pay you around 50,000, 60,000. It might go till 90,000 to 1 lakh, but definitely not more than 1 lakh for a beginner. So for a beginner, radiology is definitely better. Again, derma is also for a beginner is not good, because derma purely clinical, आपका clinic में run होता है. There are few dermatologists in Hyderabad who make daily 1 to 2 lakhs per day, based on their what do you call this, hair transplantations, all the latest derma procedures. It's a clinical branch. You need not have big hospital. If you have got your own clinic, good running clinic, you will definitely make bigger money in derma, but you need to wait for many years. So if you have got equal interest in orthopedics and radiology is better, because it's not that much saturated, and the scope is more. See, you will get to do scans, USG, CT, MRI, X-rays. So, and if you do some specialization in interventions, and definitely in cities like Hyderabad, there is a huge demand. So I think radiology is better, and for girls, radiology is much better, because orthopedics, in the night you will get emergency case. You cannot tell I cannot go. See, today is a Sunday. Some of my known patients will definitely call me, sir, I had a fall, I had a twist injury, I had a shoulder dislocation. So you need not, you cannot have your private time, very less. So you keep on get calls, and you cannot tell no, because you took orthopedics. Once you took orthopedics means you should be ready to go for any emergency case. So I think for girls, radiology is better. And one more advantage is Even the women, they feel safer and comfortable if the radiologist is lady for doing the ultrasound scans, pregnancy scans. So keeping it in mind, I think if you get radiology, please join. Sir, after ACL avulsion and meniscus surgery, I am not able to full extension. I have one leg hyperextension surgery. Leg is not full extending, sir. Ayo. Sanjay Mishra ji, can you please send your reports? Can you please send your reports? मेरे को WhatsApp करके WhatsApp में भेजिए. And even the knee movements, you can take a small video and send me through WhatsApp. We'll see the X-ray. After a long time, Dr. Garu, how are you? All good, madam, all good. Is there any age limit in INE set PG entrance? Sir, to be very frank, I really don't know about the age limit, sir. Sorry to tell about that. Thank you, sir. I'll text you over WhatsApp. Yeah, that will be better. Now and then I am getting messages from Bangladesh patients. Sir, मेरा ACL का सर्जरी हुआ. See, this is my post-op X-ray and all. So I think 1 to 2% of my videos, I mean, my viewership is from Bangladesh, I think. Is USMLE worth after MBBS or to settle in US after doing MD in India? Brother, I really tell you, if you have got the patience and if you have got parents support to support you initially, USMLE is obviously better, brother, because see, everyone goes to US not just for money. There the lifestyle is much better. Here for everything you need to struggle, everything is a hassle. To go for a passport office, to go to a RTO office, to go to a government office, to go to a vegetable market, to go to a Sunday walk, for everything it's a struggle. And one more thing, what I like about US is there the kids education is free, number one. Number two, you will have social security in the form of, I think they get some pension fund. Here in India, हमको किड्स का एजुकेशन तो फ्री तो नहीं होता. आई स्टिल रिमेंबर आई पेड अराउंड 300 to 400 rupees fee per month when I was in my till 9th class. I think 9th and 10th we used to pay per month 1000. No, per month around 2500, 3000 like that, per year 30. Because that time I studied in hostel, residential school. Now in the LKG in Hyderabad, in a decent school, you have to spend at least 40 to 50,000. Just I think only 15-20 years gap में school fees 10 times it has increased. And if you want your kid to join in a what do you call that international schools, you need to spend at least 1 lakh rupees per year. And school books, school van, all those things are extra. So if you are having the plans to move to US, better go to US. And if you are not getting the chance, okay, you can stay here, you can still serve the country, you can still service the poor. Okay, friend, nice, wish you all the success. Thank you, sir. I will text you over WhatsApp. Yeah, okay, sir, I'm getting stomach pain very often. What to do? Stomach pain. Brother, I'm an orthopedic surgeon. I think better consult general surgeon regarding that, or a general physician, whoever is available nearby. Stomach pain or abdominal pain or epigastric pain or chest discomfort. What is it exactly? Anyway, consulting general surgeon is better, I guess. Please don't neglect, brother. North orthopedic, sir, other than radiology or dermatology, which branches can have good work? Acha, okay. No. Other than radiology and dermatology, okay. Other than radiology and dermatology, I think ophthalmology is definitely good branch. I have few friends in ophthalmology. They are doing really good. They completed their PG around 6-7 years back. They are doing really good. One of my friends, she is a cornea surgeon, I think. Another cornea, retina. And other person is also doing LASIX in Hyderabad. I think once you finish your MS or DNB Aptal, if you do some fellowships in uh, laser LASIK, it's definitely a good branch where there are no emergencies. So nowadays the trend is towards getting laser surgeries and to remove the spectacles. Even my friend asked me a few times, Sai, why can't you get it done, Rani? So I'm habituated with the specs. అండ్ ఇంకోటి ఏంటంటే వైల్ డూయింగ్ సర్జరీస్ ఇఫ్ ఎనీ బ్లడ్ స్పిల్స్ అన్నా దిస్ విల్ ప్రొటెక్ట్ మీ ఈవెన్ ఇఫ్ యూ గో టు డస్ట్ ఇట్ విల్ ప్రొటెక్ట్ మీ ఐ థాట్ ఇట్స్ గుడ్ ఐ మీన్ నో నీడ్ అని దట్స్ వాట్ ఐ డిసైడెడ్ సార్ కెన్ యూ టెల్ అబౌట్ అనస్థీషియా ఆల్సో సార్ ప్లీజ్ సార్ స్కోప్ అండ్ ఫ్యూచర్ సో దట్స్ వాట్ బ్రదర్ ఐ థింక్ యూ జాయిన్ జస్ట్ నౌ సో అనస్థీషియా ఇస్ డెఫినెట్లీ గుడ్ బ్రాంచ్ so if you are interested in anesthesia please join. I have few friends, they are making really good money, I think roughly around 2 to 2.25 lakhs per month. They did their MD, one guy did MD anesthesia and other madam also did MD anesthesia. After that they did the critical care fellowship. Now they are working as critical care physicians as consultants in corporate hospitals. Definitely anesthesia is good because anesthesia, if you are in critical care na, slowly your salaries also will be increasing. But whereas in orthopedics or in any clinical branch where year by year there is no guarantee that your income will increase. It will increase, obviously you are the master in your subject. If you see your patients nicely, there are many factors which influence your practice. But anesthesia, considering orthopedics and other branches, considering the um, competition, saturation and all, anesthesia is definitely better. If you are getting, join. How much? Okay, అది అయిపోయింది. How much an ortho earn in US? I think any doctor in US will not earn less than 13 to 14 lakhs per month. I think definitely they will be making more than 15 lakhs per month. Because even the engineering engineering post MS engineering degree holders, I think they are making 7 to 8 lakhs per month. The doctors means definitely double than that. And US in doctors in US are very highly paid. Scope for MS lens surgery in Dubai. As for job, brother, I really don't know about jobs in Dubai. I think you need to ask some other person who has knowledge in that. Sir, my knees are paining and my age is 23. Oka chikka cheppandi. Brother, your knees are paining. So what is the reason for pain? You had any history of trauma? Any history of fall? Is it only pain or do you get any abnormal sounds? Do you have instability? అంటే నడిచేటప్పుడు కాలు ఏమైనా పక్కకు పోతుందా? So we need to see all these things. So is it the only pain or do you have any other problems? So I think if you have got instability or you have got any sounds or severe pain, better get an X-ray done once. You had any history of fever? You had any history of past history of IV antibiotics administration, hospital admission, any local rise of temperature, tenderness in the knee, all these things are important. Sir, what about anesthesia, work-life balance? Yeah, very good, no? It's very good. You have fixed timings. If you do as a critical care physician, no? It's more or less like a 9 to 5 job. So you can play cricket after 4 o'clock, no one will ask you. So you can use your spare time. However, it's not like a clinical branch where you have to go and sit in the OP, where you have to see the patients. It's not like that. So you can use your free time nicely. Okay, chita అది అయిపోయింది. Sir, how is MD forensics? MD forensic is really good branch, brother. Really good branch. And demand is huge because in India the number of medical colleges are coming up, increasing every year. So if you do your MD forensic, I think by the age of 35, you will definitely become a professor. If you finish it by the age of 25, 26 or 27, within 10 years, I think you can become a professor. Any advice lessons for second year MBBS? So I am kind of person like I enjoy. It's not like that. If you enjoy now, you might repent later. So in order to prevent yourself repenting later, try to utilize the time today itself. Try to read as much as possible. Try to see as many patients as possible. That is the only way how you will remember the subject. So how much you read, you will not remember. See, you have read TB lungs, or you have read TB knee. If you unless you see a TB knee patient in the ward, how you will remember? Unless you have seen a TB spine patient, unless you have seen a TB chest X-ray, how do you remember that picture? So if you want proper photographical memory, go to the ward, spend your maximum time in the ward, spend your maximum time in the hospitals. See all the rare cases, note down the cases, maintain a case logbook of your own, or at least you can take a snap photo. You can recollect whatever you have seen. So, see, we tend to forget. So, take a photo, take a video, have a discussion regarding that with your friends every daily or at least 2 3 days. So, try to spend your maximum time in the wards. Yes, book reading is important. I will not tell it is not important. Try to see as many patients as possible. Try to read textbooks also. You read the textbook, take the textbook near to the patient, see at least what he has given, what the patient has. Sir, in my state there is 2 year rural service bond. Okay. Acha. Very good, very good. It's because if there are state government's rule, we cannot do anything. Only pain. Acha. I think better. Where do you stay, Andy? I have my clinic in Hyderabad. If it's okay for you, you can come to my clinic, or I'll give my WhatsApp number 9573517107. You can WhatsApp me your reports. Only pain. How is MD Genomics? Genomics is a new branch, so I'm really not sure how is the genomics. I'll read about that and I'll tell you, brother. MD, DNB, CPS. Definitely MD is the first preference because the passing is relatively easy. Okay. When compared to DNB. DNB, you don't know where is your exam, who is the examiner, what cases they'll keep you. Suddenly you will, if you are from south, your exam center will be in the north, Delhi or Pune or Mumbai. So you have to go to the exam center. Everything is new. So if you want to struggle, if you don't get seat in MD, or if you don't get seat in MD in a government college, then you join DNB in a good hospital. Or if no, money is not an issue, if you have money, better join MD. Okay. Sir, how to study physics for NEET UG? Physics for NEET UG. I think there is lots of online content, brother. Especially physics wala videos are getting viral. So even I watched some of his videos. The way how they are explaining is really good. So if you, by any chance, if you are getting those videos, watch those videos, make utilize of those videos. In the recent times, two people inspired me more. One is physics wala and the other person is MBA chai wala. So physics wala, as you all know, foreigners have invested, I think 5 to 10,000 crores in his company, physics wala company. And MBA chai wala is opening outlets, chai wala outlets. He has no background, he has no support. Without any support, he's doing wonders. He's giving jobs to many people. It's really great. Sir, how to study for IPND? Sir, how was Joy Hospital? Sir, Somaji Guda, Joy is very good, sir. You can definitely join. డాక్టర్ గారు అక్కడ చాలా బాగా సర్జరీలు బాగా చేస్తారు, సర్జరీలు కేసులు కూడా బాగా అవుతాయి. సో మీరు జాయిన్ చేయొచ్చు, ఏ ఇబ్బంది లేదు. నాగేశ్వరరెడ్డి గారు ఓకేనా? మీరు ఈ వీడియో చూడటమే కాదండి, కొంచెం లైక్ చేయాలి, మీ ఫ్రెండ్స్ అండ్ ఫ్యామిలీకి షేర్ చేయాలి. మన ఛానల్ని తొందరగా 10,000 సబ్స్క్రైబర్లు రావాలి. మెనీ ఆఫ్ యూ ఆర్ వాచింగ్ మై వీడియోస్, ఈవెన్ ఐ డోంట్ like, please subscribe, I don't like that somehow. So this time I am asking you, requesting you, because I am very nearer to 10,000 subscribers. So with all your support, I want to cross it by this month end. And I feel happy ఎక్కడైనా, ఈవెన్ పేషెంట్స్ సమ్టైమ్స్ దే ఐడెంటిఫై మీ, సార్ మిమ్మల్ని అక్కడ చూసాం ఇక్కడ చూసామని. సో సమ్టైమ్స్ ఐ ఫీల్ హ్యాపీ ఆల్సో. థ్యాంక్ యూ అండి, థ్యాంక్ యూ. హైయెస్ట్ ఎర్నింగ్ డాక్టర్స్ యూ హ్యావ్ సీన్ ఎవర్, హైయెస్ట్ ఎర్నింగ్ డాక్టర్స్ యూ హ్యావ్ సీన్ ఎవర్. దట్స్ వాట్ బ్రదర్, ఇఫ్ యూ హ్యావ్ గాట్ ఏ బిగ్ కార్పొరేట్ హాస్పిటల్ వేర్ there are 20 surgeries going daily, 20 surgeries in your hospital, in your private corporate hospital, per day 20 surgeries or at least 10 surgeries means you can make monthly around 50 lakhs. 20 major surgeries or at least 10 to 15 major surgeries. So to earn more you should have your own hospital. As a freelance surgeon you cannot earn more than 10 to 15 lakhs in a month. For that you should have your own hospital, and to have your own hospital you need to spend crores of money to build a hospital. So that is the reason why many of the senior surgeons they don't prefer building their own hospital, because nowadays building own hospital is not a easy job. It's more risky. You need to have proper infrastructure, you need to have lots of permissions, you need to maintain full staff, you need to have very sophisticated infrastructure, all advanced machinery. So you need to spend for 100-bed hospital at least you need to spend minimum 30-40 crores. So to get the advanced CT, X-ray, C-arm, ultrasound machines, MRI, so you need to spend more. So nowadays some surgeons they don't have the interest of having their own hospital. Instead of that they try to work as a consultant in some big hospital who have already established, who have already had a sufficient patient base. And one more thing, as you said, after 4 to 5 lakhs per month, it doesn't make much difference in our lifestyle to earn more, even if you are earning more. See, once you have got your own home, your own car, your own clinic and all, I think after that sir, please suggest good hospitals in Hyderabad for DNB or with good hands. I heard Saint Teresa Hospital is good. దాదాబాయ ఐ థింక్ దేర్ సెయింట్ తెరేసా ఒకటి ఉంది, సెయింట్ తెరేసా దీనానాథ్ మంగేష్కర్ పూణే కదా. Saint Teresa is good, Kim's Hospital is good. Hands-on will be definitely less in Hyderabad, as because it is there in all corporate hospitals. So corporate hospitals you cannot expect much hands-on. For small Durgabai Deshmukh, yeah, sorry I could not recollect. Durgabai Deshmukh is really good hospital. I have 2 friends who did my DNB from that hospital. So hands-on you cannot expect in big corporate hospitals, because see, for tibia nailing they come to a premium hospital to get operated by a senior surgeon. So obviously that senior surgeon he cannot trust you in the initial days and give the surgery. See, at the max he can give small cases. So he cannot give you big major cases, right? Even if you are in that position, you cannot give. So don't expect much hands-on in private hospitals. But to get, you will have good exposure in knee replacements and hip replacements and spine surgeries. You will have good exposure definitely. Hands-on will be less definitely when compared to government hospitals or trust hospitals or charitable hospitals. I think once you go there, talk with the PGs there, then you will get good idea rather than blindly following my views, my video. Sir, please suggest అది అయిపోయింది దుర్గాబాయ్ అయిపోయింది సార్ కెనడియన్ yes brother why can't DNB person can apply for FRCS. There is no restriction on that. So can I ask you one question? Can you message you are from which state? Everyone whoever is watching this live. So many of you from Maharashtra or Karnataka or Kerala. Acha Kerala. Okay, Ajay Matthews. Nice. Sir, can a DNB apply for? Yeah, you can apply. No problem. So if you have any doubts, please ask friends. It's already around 47-50 minutes. Maheshwaradi, Andhra Pradesh. Okay అండి నైస్ మాది కూడా ఆంధ్రానే ప్రకాశం జిల్లా మార్కాపురం యాక్చువల్గా. So I think we'll catch up again friends. I'm getting sleep. I might, if possible, I'll go for shuttle now. Okay friends, we'll catch up some other time. Okay, thanks. Sir, I'm getting in this year I got 15k. If you want to take MS, I have to take loan. That's why thinking of DNB. Brother, taking loan and joining is not a great idea, I feel. So it's up to you anyway. Because loan you have to take around 20-25 lakhs. No, to pay again you will spend around 30-35 lakhs with interest. I think you need to work hard for 7-8 years after your completion of PG. So think once again. Yeah, DNB is not a bad option. Definitely not a bad option. 2 toppers in my batch took DNB, and one of my senior who got some 7-8 gold medals, silver medals and all, is one of the topper in his batch. He took DNB radiology. He's doing extremely good now. I think he passed around 5 years back itself. So he's just 1 year senior to me. Even I passed 5-6 years back. So DNB is a very good option. You need not think like DNB, ayo, what happened? Nothing like that. Okay friend, I'll catch you. Okay, bye. There's still 7 people waiting. Okay friends, bye. We'll catch once again. Please like, share my videos. So by this month end, we'll cross 10,000 subscribers. Bye.